Health Minister Zweli Mkhize says the decision to allow taxis to operate at full capacity was carefully considered, but he also acknowledges that this goes against scientific studies, saying that taxi operators will have to follow strict safety guidelines.
The worst case scenario of how the infection would go on in a taxi is a situation where the taxi is full, people are not wearing masks, and those who are infected are coughing, they are not observing cough etiquette, and that their hands are not sanitized, and everybody is sitting there, the windows are closed. Then that pressure is actually going to give you the highest amount of infection. We have therefore sought to mitigate against that. Amongst the issues, now we've looked at the sustainability of the taxis, the work that has been done by the Department of Transport to look at what numbers of people would actually sustain the industry. Forget about the taxi operator. Let's talk about the industry, objectively now assessed by the department. They realize that what is proposed will not make it possible to get the taxis to run every day. So we've reached out then to say, okay, let's then look at a number of mitigating steps which are going to negate all of the things that I said are causative factors for the infection to rise. Number one, everyone who must go into the taxi must have a mask. We will actually take action on the operator who will not insist on people putting on a mask. That's why we put it that way. That's why we put it that the owners, the managers of buildings must be the ones who must insist on enforcing the use of masks. So that's the one issue. The issue of hand sanitizers is also important because the handles of the vehicle is where people can actually exchange, contamination and therefore can get infection. So then they must actually take care of that and make sure that people's hands are sanitized. Thirdly, when they go inside, because distancing is not possible, then we've said they must open the windows. Now there's a degree of opening of the windows that is enough to create the flow of air so that the outside air can ventilate and push the air out of the vehicle enough to ensure that the droplets don't have time to settle on the individual.
Well, for more on this, we're joined now by Stellenbosch University infection expert, Professor Shaheen Mehtar. Professor Mehtar, good evening to you. The Health Minister there talking about ventilation, the idea of if you keep windows in a taxi open, you have proper ventilation, people will be safe and the virus won't be transmitted. Do you agree with his view?
Good afternoon, yes. I think if the taxis are going at 100% capacity, then there is a much higher chance of people becoming infected if the windows are closed. So ventilation is an absolutely critical part of making sure that the virus doesn't remain in the inside of the taxi. It's also really important to look at this as being one of the major risk factors. And even though we know that people should be wearing their masks, they wear them very badly, usually under their nose or under their chin, so it doesn't provide the protection that they need. And I think these two factors make a big difference towards transmission. Also, they really need to make sure that the taxi owners are responsible and make sure that people have hand hygiene available and hand cleansing, as well as making sure that the inside of the taxis are clearly wiped and sanitized properly between trips or in the beginning of the day and at the end of the day. So the most crucial part of this has got to be keeping the windows open. Now, I know this is going to be difficult in the winter, but it is a difference between that and transmitting the virus to the people that are sitting in the taxi.
So to sum up your view then, if I may, and tell me if I've got this right, if you have open windows, you're wearing face masks, you're actually relatively safe in a full taxi.
I don't think it's a good idea to have a full taxi because the social distancing or the distance that we need between people is very important. However, this is a mitigating situation. And if people have to travel and there is no other means of traveling, then both the passengers and the taxi owners must be responsible and make sure that it's as safe as possible. And therefore, the window opening and making sure the masks are worn over the nose and mouth is absolutely crucial to reducing transmission within the taxi. I mean, don't forget, the inside of a taxi is like a box. And if we don't allow ventilation in there, the virus will remain and will keep circulating inside. So in order to get rid of it, as we do with anything, you have to open the window and make sure that it can go out.
This may sound like a silly question, but everybody who gets out of a minibus taxi immediately has to walk some distance. Does that walk help? Does it maybe remove the virus from your clothes or from your hands?
The virus is not known to last on the clothes very long. However, the hands is another matter, and therefore hand sanitizing is absolutely vital. Also, if you're sitting in a taxi, it's advisable that you don't touch your surfaces around more than necessary. But the other thing which is very common in a taxi is for people to entertain themselves by using their phones. And that itself would actually increase the risk of transmission if it's going to get onto your hands and you haven't sanitized your hands before you start touching your face. And I think this is a really important point. So if you're in the taxi, I know it's really boring, but you have to make sure that your hands are kept to yourself and that your phone is kept in your pocket if possible.
It's really interesting, the importance of face masks. I mean, in a way, in South Africa, we seem to actually be quite far ahead of other countries. Never mind the United States, which has managed to have a political fight about face masks. But on the London Underground, for example, and in shops in the UK, and only in the last week has it become mandatory to wear a face mask in a public place. Here, almost everyone's been doing it.
Well, we've been actually, I think the face mask policy, the universal masking policy, was signed off on the 16th of April. The reinforcement of that has been a bit shortcoming. But having said that, many people have understood the need of a face mask, because if you wear a mask, you actually keep the droplets inside. And if the other person is wearing a mask, the droplets from that person remain inside, which means that you can actually protect each other. So it's I protect you and you protect me. And this is a responsible way for society to behave. So the face covers, and it's been clearly shown that countries that have got 100% universal masking very early on in the epidemic have had a far lower mortality rate than those countries that have not. And we've seen the examples around us, which I don't think we need to go into, but you've mentioned yourself. It's also interesting to note that the United Kingdom is going to go into universal masking very soon as well, because they understand now that when people are in crowded places and they can't move away and can't socially distance, that it is important that we do cover our faces and that we protect our mucous membranes and we stop other people from getting our droplets. Bearing in mind that asymptomatic people are not going to be known to be carrying the virus, to have signs of the infection for 4 to 5 days before they are infectious. So it's really, really important that once we go into a public space, that we carry on and maintain our masking. But the essential thing is that we must mask properly. We have to cover the top of your nose down to the bottom of your chin to make sure that your face and your nose are totally covered. Sticking your nose out over the top of a cloth mask is really not a very good idea.
Professor Shaheen Mehtar, I really do appreciate the time. Thank you very much indeed, an infectious diseases expert at the University of Stellenbosch.